Kilkenny recently attended a protest outside of that facility with the members of the Psychiatric Nurses Association, and they were protesting about the quality of care that they give, or that they're able to give, to the patients in that facility. Now, I have visited patients there over a long period of time, and the facility has not been updated. It requires significant capital expenditure, and it requires investment in the staff. The staff are pushed to the pin of their collar, and it's unfair to staff and to patients that the current situation would be allowed to continue. Yesterday, there was 51 patients in a 44-bed unit. Patients were being admitted to sit on chairs where they are being asked to stay and sleep while waiting for a psychiatric service. And it isn't good enough. And I'd like to point out that in the context of that protest, that the staff attended in their own time. They did not vacate the wards. They came in from their lunch breaks in order to highlight what they see as being an unfair system and very poor care for the patient. In terms of those that are there for long term, some of them are in an inappropriate setting. They're waiting for placements elsewhere. You cannot get counselling services. In fact, some patients are being told they will have to wait for 3 to 6 months before they're seen. Now, if you're in a community setting outside the hospital, the same waiting list prevails. How can you tell someone that is in a crisis regarding their mental health that they will have to wait for 3 to 6 months? Now, there are volunteer organisations on the ground, such as Derek Devoy in Taxi Watch. They monitor those that may be on the verge of suicide. They bring them to the attention of the services. But what can the services do because of the fact that they're underfunded, they're understaffed, and they're under pressure in the DOP? And that's not me saying that, Minister, for political purposes. It is those that are centre to delivering the care are saying it. The HSE is referring patients looking for counselling services to Chok Tom, a voluntary organisation in Kilkenny City, and they're providing immediate, on-the-spot counselling services. But the HSE is refusing to pay them for the service because of the fact that they believe they're referring the individual to a voluntary service, or a service that's run on a voluntary basis. How can that be? How can you allow that to continue? I stood on that picket line with another friend of mine, a councillor, Joe Malone, who is very much associated with the care of those that need it in terms of their health and their mental health and well-being. Now, I'm asking you, what are you going to do to provide capital expenditure and to provide the staffing requirements that are needed? What plans are there to extend the DOP? And when will an extension or refurbishment of that centre be provided for? Because this has gone on over a long period of time, and someone has to cry stop before we have another death by suicide. It is that critical, Minister. And I would invite you to visit the service, to visit Chok Tom, to talk to Derek Devoy and the other service, and to come and see for yourself at first hand what's going on in the Department of Psychiatry. And we also need investment in the management of that service. It's absolutely deplorable that the managers of a service cannot see the issues that are confronting their staff, and that same management is not planning ahead for the numbers that are attending the service, and indeed for the staffing levels that are required. And I draw your attention to the fact that the same set of circumstances prevail with the Waterford services.
Minister, 4 minutes.
First of all, can I thank Deputy John McGuinness for raising this very important question, because I know from his work in Kilkenny that he cares passionately about the mental health services. Can I say that Carlow Kilkenny Mental Health Services focus on delivering a broad range of primary and community-based services, as well as specialised services for children, adults and older people. These services are provided in a number of different settings, including the individual's own home, inpatient facilities, outpatient clinics, acute day services, day hospitals and day centres, and high, medium and low support community accommodation. The 44-bed Department of Psychiatry, based in St Luke's General Hospital, Kilkenny, is a designated approved centre for acute inpatient services in the Carlow Kilkenny South Tipperary area. This enables all acute inpatient admissions to be managed at a single site. Referrals to the Department of Psychiatry are through a consultant psychiatrist who makes the clinical decision to admit based on the level of acute presentation or need. I am pleased to say that I am informed by the HSE that there are no waiting lists for admission to the acute inpatient service. The HSE does, however, acknowledge that at times there can be issues of overcapacity, and I take your point there, Deputy, at the Department of Psychiatry. When this occurs, all additional controls in relation to risk management are applied. This includes ensuring that staffing levels are at an appropriate level. In relation to staffing, a number of posts are within the National Recruitment Service for filling and are currently being filled in a temporary capacity. In addition to the Department of Psychiatry, there is a dedicated psychiatric liaison team operating from the Emergency Department in St Luke's. All service users presenting to the Emergency Department who require psychiatric assessment will receive that assessment within agreed timeframes in line with the relevant Department of Psychiatry Emergency Department guidelines. Onward referral pathways are agreed with all service users last Glencorla upon completion of a psychiatric assessment in the Emergency Department. Pathways can include admissions to an acute unit, referral to a relevant community mental health service team, or referral back to their own GP. In line with the Vision for Change and Mental Health Commission recommendations, there has been significant developments in the area of community mental health services. The comprehensive development of the community mental health teams has brought together key professionals to provide a wide range of mental health interventions on a multidisciplinary basis to service users in the community. This approach is based on assessment of a person's needs. The HSE has assured me that any waiting times for community mental health teams are in line with the National Key Performance Indicator requirements. In addition, the development of home-based services teams in Carlow Kilkenny has ensured the delivery of a service that facilitates in the service user's own home environment. I am also glad to have the opportunity to share with the Deputy the continuing steps being taken to improve mental health services in this area. The Carlow Kilkenny Mental Health Service is engaging in the reform programme to realign services to primary care networks in line with national policy. The aim here is to facilitate integration of services and to seek to provide a seamless service to the service users. In addition, there is significant focus on the involvement of the service user in the management of their illness, through initiatives such as involvement centres and a recovery college. I hope this information has addressed the issues raised by the Deputy to his satisfaction, and can I say I will also report back on the other issues that he raised with me to Minister Simon Harris. Thank you.
Deputy McGuinness has 2 minutes.
No, last Glencorla, I have to say, Minister, it isn't good enough, because you haven't addressed any of the issues. As I said to you, there's 44 beds, there was 51 patients. How can you tell me that that is good health care, be it mental health or otherwise? How can you say to the family that is waiting for a counsellor 3 to 6 months that that's satisfactory? What you have read out there, and I respect the fact that you're probably given this note from the HSE, it's a load of nonsense. It isn't true. And to support that, the Psychiatric Nurses Association, they went out on the picket line. They went out on the protest march. They didn't do that for fun. And this reply that you have given does not answer the questions. It is very unfair to put that raw mate on the record of this House without addressing the real trauma that is affecting the families of those that are patients in the DOP in Kilkenny. I ask you again, come down and see for yourself. Come down and visit them. Come down and see the capital expenditure that's needed. It's obvious. And please explain to me why the HSE can outsource their counselling service to a voluntary organisation and not pay for it. It's reprehensible that a government would stand by and watch what's going on in the South East and in particular in St Luke's Hospital in the DOP and not do something about it. It's unacceptable that the management would not acknowledge the fact that they're not delivering the services, that there are people in the DOP that are inappropriately placed, that young people and others are asked to come in as patients and take their place on a chair and sleep there. Mental health is not like a broken leg. It's a broken life. And we're putting people's lives at risk if we do not accept the fact that our services are falling down around us in that department and that we're not prepared to acknowledge it. And it's not that you're not prepared. The HSE are not prepared. The Department of Health is not prepared because they wrote this note for you. So therefore they've been told a story which is absolutely misleading. Meet the union and talk to them about it. Go down and see the hospital for yourself and at least acknowledge the fact that something has to be done. You cannot leave people who are suffering from mental health and poor well-being in a situation where the services cannot cope with what's happening. And I would ask for a better response, Minister, and I would ask that the HSE will be forced to acknowledge what's happening on the ground.
Okay, again, can I say that I did say that I would bring this message back to Minister Harris in relation to the issues you raised. And you did raise very critical points here about it being unfair to the staff and to the patients. And I accept your point about sitting. It's unacceptable for people to be sitting on chairs. And also the very important fundamental question when you talked about the capital expenditure and refurbishment of the centre. But can I also say there is in Kilkenny significant focus on meaningful involvement of the service user in the management of their illness with the development of recovery-focused services. There are 6 things going on there, and I think it's important that we acknowledge that. The development of involvement centres, which are peer-led support services, are located both in Carlow and Kilkenny. Secondly, development of a recovery college, which delivers programmes for people who have lived experience in mental health. Thirdly, delivery of RAP, Wellness Recovery Action Planning, which is a programme to help people to manage their mental health, and a class programme to support service users and their relatives. The RE project, which focuses on recovery from mental ill health. And the final thing, the service users forums, which facilitate service users to feed back on service delivery and the development of service initiatives. But of course, I take the point if there are major problems like that emerging, and I think it's important that ministers do see it firsthand and do engage with the psychiatric nurses, and that's something that I'm very much open to, Deputy. Also, it's important to acknowledge that in Budget 2018, an additional £35 million was put in to develop mental health services, and the Minister for Health has also committed an additional £55 million to funding in 2019, delivering a total of £105 million in additional funding for the implementation of a vision for change over a 3-year period, 2017, 18 and 19. So if the money is going in there, I want to see exactly where it's going, and I absolutely take your point. If there are issues like this that are raised in Kilkenny, they have to be dealt with in a comprehensive way, and I will actually bring that message back to the Minister. Thank you.
Move on now to